I'm here at C.O.R.E Methadone Clinic interviewing a counselor named Paul about the methadone program.
All right. How long has this methadone clinic been open? This methadone clinic's been open for 30 years. It's, as a matter of fact, this clinic has been here longer than any other clinic in Sacramento. It's changed names and ownership, but other than that, we're the longest standing clinic in Sacramento. What are a few of my main responsibilities here? Well, my main responsibilities are to do counseling, primarily drug and alcohol counseling, but I also am a public health specialist, so I test people for HIV, hepatitis C, and do other activities involved with public health. I also do intakes for the buprenorphine program, which is another substance that's similar to methadone, but it has a lot more freedom attached to it in terms of dispensing. What are the pros and cons about methadone? Well, I would have to say probably the worst thing about methadone is that it's an addictive substance, and it's a narcotic substance. So you're still dealing with addiction in terms of when it comes time to get off of the substance. And there is also abuse potential if it's mixed with other substances such as alcohol or benzodiazepines. There's an abuse potential there. The upside of methadone, which is there's a tremendously larger upside than there is a downside, is that people aren't engaging in illegal activities to get narcotic substances, to get opiate substances. They're not injecting drugs. They're not, contributing to taking away dollars out of the community for all emergency rooms visits for abscess and loss of jobs and just the anguish that it causes the family when someone's actively in their addiction. I see people's lives here every single day that are transformed, and they're leading absolutely productive and responsible lives, and students and people that are working, mothers, single mothers, and the list goes on and on in terms of success. Let's see. How do patients pay for their methadone? Well, there's a couple ways. There is private pay, and there is a program called Drug Medi-Cal. So there's a certain pot of money for in the Medi-Cal fund for rehabilitation. Is there an age requirement for methadone? 18 is the age requirement. There has been a few cases that I've heard of, and I'm sorry, I don't know much about this. I think that we've had somebody here before that's 16 or 17. It's an unusual case. Of course, the parents would have to come in with the minor, and they would have to sign consents and releases and for treatment. It does happen occasionally, but 18 is generally who we deal with, 18 and above. How long can patients take methadone? Well, they can take methadone anywhere from 21 days to the rest of their life. It depends. There's a 21-day detox program that we have. We have a long-term detox program, and then we have a methadone maintenance program. We have patients that have literally injected heroin for 50 years. And so sometimes asking a patient to come in here and change a behavior that they've been doing for 50 years is really unrealistic. And so for some people, the best that we can do, and in the spirit of harm reduction, is they can continue on methadone for the rest of their life. And for others, a 21-day detox is sufficient to get them off of, say, a prescription that abuse that turned into something, started to turn into something else. So there's a huge range there. How long would it take for someone to get addicted to methadone? Well, generally, this is a narcotic replacement therapy, so someone's going to be coming in addicted, and what they're going to do is they're going to basically switch addictions. So, but without all of the negative things that happened earlier on that I had already mentioned. So, how high can a patient's dosage be? We have our medical director has a little bit more of a conservative stance on how high a dose can go. 140 milligrams is the top, and then after that, you'll have to get blood serum levels done. You'll have to get an EKG done. In a very, very, very small percentage of methadone patients, it can be something called an effect on a QTC level. So it's the fraction of a millisecond in between heartbeats. It can prolong that. So beyond a certain, California is a more conservative state in terms of what they can give, and then on top of that, our clinic is a little more conservative also on the cap. So, what is C.O.R.E Medical Clinic success and fail rate? Again, in terms of, what do you see as terms of failure and success? We have people that come in from day one and they quit using illicit substances, and they've been illicit substance free for years and years, and they're living absolutely normal, productive lives. And then we have those people that might have an occasional relapse too. So is that looked upon as a failure? No. And as a matter of fact, a relapse can be definitely lay the grounds for a stronger recovery. I know that our success rate, I don't know the numbers, but I know that we do have one of the more successful rates in the state, and that's all I know. I don't want to put any numbers on that I'm not certain of. What are the patient's routine when they come into the clinic? Well, number one, they come in the door, they check in at the front desk, and usually when they check in at the front desk, they're told that you have to do a UA today, or you have to go see your counselor today, or maybe you need to see the nurse for a particular reason. We have different programs going on. We've got smoking cessation programs, we've got vaccination programs, we've got other programs that are going on here, and that sometimes that our allied health professionals are involved with. So they might need to see them, or they might just be simply told you're clear to go dose, and then they would go up to the window and they would get their dose, or if it's their day for counseling, then after that they would go see their counselor. But that's basically the routine that happens. We offer a lot of groups. They can go to a group after they're done, or basically depending on what's on their schedule. How many times do they have to meet with their counselors? Oh, that depends too. That depends on, they have to meet with their counselor at least once a week for 50 minutes. If they're on one of the first steps, that decreases the longer that you've been here, and eventually you only come in 3 times a week, then you only comes in twice a week, once a week, and then it gets all the way up to where you get to an advanced step where you only come in once every 27 days, and then you only have to see your counselor once a month. But that would be for 50 minutes. So the minimum counseling time that you would have is once a month for 50 minutes. Do we take urine samples or blood or alcohol tests? We breathalyze people if it's smell alcohol, if there's an issue with alcohol, if there has been a history of alcohol in the past. We do saliva tests for those that may have problems urinating. But mainly what we do is we do urinalysis testing. So yeah. So why do they take these tests? Well, the reason why they take these tests is because we are mandated by the federal government that we do random UA testing, and that if a person is continuing to use illicit substances, that they not be eligible for the privileges of having take-home medications. And that's the chief reason why we test people, for privileges and because it's mandated. What is the most difficult task here at the clinic? What is the most difficult task here at the clinic? Wow, that's a good question. I like my job, but I deal with people that are having a lot of, sometimes when people just get here, they're struggling with a lot of issues. They have financial issues, they have medical issues, they have relationship issues, and it goes on and on and on. And sometimes, purely from my point of view, the counseling component can be tough to deal with, and so I have to make sure that I take care of myself in terms of that. Can women take methadone when they are pregnant? Yes, women can take methadone when they're pregnant. As a matter of fact, we are one of the only clinics that do give women methadone when they're pregnant, and it is recognized as a viable treatment option for women. And not only that, if a woman is opiate addicted and they become pregnant, the last thing that you want to do is try to detox off of opiates, because that's the thing that could cause a spontaneous abortion, fetal distress, particularly in the first trimester. It's when the baby's developing at that stage. It's a much better outcome to have the patients stabilized on a dose. We have babies that are born here all the time. We have babies that are born fine with no withdrawals at all and are able to leave with their mother the very first day. And there's some that have to stay in the hospital up to maybe 2 weeks, and they are given medicine to deal with the withdrawals. So we see a few different things happen with the babies, but what we do always see is that the babies after that, maybe that initial rough period at the first 2 weeks, they're healthy, happy, normal babies that develop, and they're fine, and there seems to be no residual problems at all from methadone, and there's been many studies that have gone over the last 30 years that can substantiate that.
All right, thank you for this interview.
You're welcome.